I will take this opportunity in this video to address some of these misconceptions that patients may have on asthma and the questions that they have with regard to the disease and treatment. My name is Dr. Mohammed Fauzi Abdul Rani. I am a chest consultant. I am working in Thomson Hospital, Kota Damansara. We see a lot of asthmatic patients in our clinic. Asthma is a very common condition. It affects nearly 2 million people in this country. There are about 2 million asthmatics in Malaysia, and the prevalence of poorly controlled asthma is quite high, maybe as high as 30% of the total number of asthmatics in this country. Each patient has their own triggers, and this could include pollens or pollutants or even smoke in the environment. When asthma is triggered, it will cause symptoms which could be cough, chest tightness, breathing difficulty, or even wheezing, and therefore asthma is really not a disease in the head, but it is a disease that is affecting the lungs. So symptoms vary between asthmatic patients in terms of the types and frequency, and also the timing of when it occurs during the day. Exercise is very important for the lung health, and it is also important for general well-being of a patient. There are two types of asthma medication, and one is called reliever and the other one is called controller or preventer. They have different aims in the management. The preventer and controller are the most important because they control the inflammation in the airways. They are to be used over a long period of time, and they will ensure the disease remains in control and you have no symptoms. The reliever would be to use when the symptoms occur on intermittent basis. As long as you take the preventer medication, it will remain effective to control your disease. I think the bad reputation steroid has is because of the misuse of the medication among the public. In the treatment of asthma, inhaled corticosteroid is essential because it controls the inflammation. If a disease is not treated adequately, it will cause permanent damage to the lungs, and in the long term it may cause delay in growth, delaying the onset of puberty in children. Asthma usually develops in childhood, but the symptoms sometimes regress as you get older in the adults. Absence of symptom does not necessarily mean that disease is not there, because it may come back if you are exposed to the triggers, and it may cause the same symptoms as you have in childhood. And sometimes in adults, even without history of asthma in childhood, you may develop asthma. And some of the risk factors that may cause this would be obesity, or any smoking in the environment, or pollutants, and they may cause you to develop what we call adult onset asthma. Usually an asthma attack has triggers, so the best way to prevent an attack is to avoid the triggers. But sometimes triggers are just everywhere and they are just part of your life. In that case, it is essential that you take the medication prescribed to you by your doctors to control your asthma. Even if your symptoms have disappeared with the medication, you should not stop any medication, because the medication is designed to control inflammation. Usually we would allow for a period of about 3 to 6 months before any consideration of reducing or stopping the medication. You should listen to your doctor and only stop or reduce medication upon medical advice. You have to take the medication every day, because this is the only way to control the disease and prevent the symptoms from happening. You have an asthma attack if your chest becomes very tight, you find breathing very difficult, you cough, or you may even wheeze. If your symptoms get worse, there are a few maneuvers or positions that you can take to make the breathing a little bit better. Remain calm, breathe through your mouth. You sit on your chair with your hands outstretched to the back of the chair, or you could stand up and do the same position with hands outstretched to the window. And those positions sometimes can help you with your breathing when the breathing gets very tight. It's absolutely possible to get symptoms-free days when you are asthmatic, and this is achieved once you have achieved control of the disease. You'll have a good night's sleep, you will not be absent from school or work, you can participate in physical activities, and you don't have to visit any hospital for asthma. Although asthma is a lifelong condition, but it can be managed with the right medication and the right self-care. The major mistakes that the patient make are they skip the dose, they self-adjust the dosing, or they self-medicate themselves, or the other is they completely forget to take the medication. But it is essential that controller medication is taken on a daily basis. Okay, that being said, the correct inhaler technique would depend on the inhaler being used. The patient must understand the correct techniques for the inhaler.